Next up, we have Jeff Raheb, who we missed yesterday. He was able to record his expat presentation for us, and it's on the conference website, so you can go and take a look at that and listen to that at your leisure. But today, Jeff is going to talk about the Colombian healthcare system. And yesterday we heard about health insurance and some options there, but the healthcare system is more important to know about it. And from my perspective, the U.S. Health insurance company runs the healthcare system, which is why it's such a mess. But in Colombia, the healthcare system is excellent, especially in Medellin, where they have excellent hospitals. And I've had some different things done there, dental work and some medical things. And Jeff's going to talk to you more about the quality and the availability of the healthcare in Colombia. Jeff? Sorry. You're on mute, Jeff. I think you need to, there you go.
How we doing?
I can hear you now. Perfect, thanks.
You're very good. Thanks so much for the introduction. Let me get my thumbnails up here. My name's Jeff Raheb. I'm a chiropractic physician. Can you guys see me too? Okay.
Yep, you're all good.
So I'm a chiropractic physician. This will be the third year that I've done the Live and Invest Overseas Medellin conference. Sorry you guys missed out on the live presentation that Heather and I tried to do yesterday. That's been recorded, so you can go catch us on the recording. You're moving where? Are you crazy? So I'm a physician. I speak Spanish. We've been living here for 3 years now. What I'm going to share with you is our personal experiences, Heather and I, and then other expats that have given me firsthand information, also some friends and family, about their experience using the system. I'm not just talking about the insurance system. I'm also talking about private pay, doing a kind of a combination of insurance and private pay. So we're going to cover a lot of things here. Have your questions ready, because I always, whoops, I didn't set my timer, hold on. Because I always want to save 5 minutes at the end for Q&A. The disclaimer now, things are always changing. You've probably heard that a couple of times from presenters. So the information that I'm sharing is our personal experience. The exchange is changing, kind of the rules and regulations. So if you hear some different information from some of the other presenters that are specializing in insurance or the supplements, or you know, a physician, then you know, obviously that would be the most recent information. So away we go. So 8 of Latin America's best hospitals are here in Medellin, Colombia. I know where just about all of these hospitals are, so they're in close proximity. This one here, Clínica Medellin, that's like a 5-minute walk from my place. So I've been in quite a few of these facilities. There are these giant towers that have hospitals, emergency rooms, surgery. All the physicians are all in there, so it's kind of like one-stop shopping, a lot of the diagnostic centers. Let's compare Medellin to the U.S. healthcare system. So when this was done, and I don't know where we're ranked right now, but it's probably not much better. United States was ranked 37, number 37, on the World Health Organization's overall healthcare performance. Colombia is ranked number 22. The idea here is to have the number smaller. Number 1 would be the best. So 22 is better than 37. Medical tourism's increased by 62%, and that was from 2010 to 2015. From what I'm seeing, that continues to increase. That continues to be a trend. So while U.S. hospitals lost more than 20,000 patients last year, and that would have been 2015, to MRSA, the increase is happening here. Okay. Health insurance costs, typically 1/4 to 1/5 the cost in the United States. And that's just kind of overall a spitball, insurance, private pay. So what is EPS? EPS is the basic government subsidized healthcare plan. If you're from the U.S., the best analogy is this is an HMO. And so for us, when we first entered the system, as a couple, Jeff and Heather paid $32 a month for our premium for our insurance. And what's kind of cool is, remember I told you this is always kind of moving. I'm quoting prices in dollars. It's always changing because I've taken the pesos and converted them to dollars. So these are, again, remember these are just spitball, but just as a kind of an aha, because the dollar's been so strong lately, our insurance premium has actually gone down since we started 3 years ago. Another thing is you can pay your insurance premiums up to a year in advance. My wife says she takes care of that. So if the dollar is very strong at the beginning of the year or any time, you can convert dollars to pesos and prepay your insurance and get an even better savings or an even better bargain. So what happens on this plan? So you get signed up. We use the facilitator, Angie. She speaks English. She speaks Spanish. She has transportation. She knew the system. She says, I'll help you get signed up. Fill out a bunch of forms, give them your documentation. We go to a couple of places, sign, submit documents. We're signed up. Then what happens is so EPS or EPS will assign you a facility, a home hospital. That's where your gatekeeper, that's where your home physician is going to be. You can also change where you go for your home facility, and you can do that online. You can also buy a supplemental, and many of those supplementals require that you have this basic plan first as a prerequisite. You'll be hearing vendors or you'll be hearing presenters that take care of supplements. They're going to give you all the info. I'm not going to dig too deep into that right now. The supplemental plans, though, do entitle you to faster service, no referral for some of the specialists or diagnostic procedures. So those are the advantages to those supplements. We don't have one, so I don't know exactly what the premiums are. I'm going to show you what they can include. And I've heard anywhere between $100 and $2 a month for a supplement. I don't know where that is now, and you would just have to get with someone that sells those plans. EPS. This is an option for people that might not be eligible for the private insurance or the supplements, and that may be due to age or pre-existing conditions. But I do know retirees, expats that are, 65, 70, 75, maybe they didn't want to get those supplements, but they are eligible and they do have coverage under the EPS system. EPS is a good solution for people that plan to reside in Colombia permanently, although I don't know why you couldn't have the plan and live here part-time and then just come here for, for your medical visits, things like that. And under the EPS system, or EPS, referrals needed for specialist diagnostics and procedures unless you have a supplement. In EPS, you may experience wait time to see a specialist. It's an HMO. Have surgical procedures or diagnostic exams. Check my time here. This is a flyer that's presented by the supplemental insurance providers. It's in Spanish, so we're going to go over this briefly. These are the services on the left. Oh, I don't have a pointer. These are somebody wants to send me a message and tell me how to turn the pointer on. So the services are on the left, and then you can see the yellow or the orange there. That's the basic plan. That's the EPS, $30 a month for the couple. Oh, okay. You see the plus plan there, and then you see a preferential plan. Thanks, whoever's doing that. And so you can see the tick boxes. The less you spend, the less services or the less direct access you have, I should say. Not services, but direct access. And the more you spend, the more direct access you have. You've got vendors, again, that will explain this more to you in detail. These are, again, just things like, in-home, hospital stays. So these are all the services. And again, to exemplify here, the orange is the basic plan. The blue is the next plan up, and then the green, obviously, is the preferred plan. You got a lot of options, so I'm going to talk about that. So speaking Spanish definitely helps. It served me and my family and our friends and family well. It's not a requirement. There are people here that can help you facilitate. Many times in the hospitals, they've got a translation department or facilitators there. You'll also find that the majority of physicians and professionals speak some English, can communicate with you. The reason is that many of them get their education in the U.S. and or they're using English medical textbooks. So I've encountered very few that don't speak some English that you can't interact with. Over-the-counter medications available that'll reduce cost. Over-the-counter meaning cold, flu, allergy, etc. You'll find later on in the presentation, though, that that you'll be able to get a lot of prescription medications that would require a prescription in the U.S. over-the-counter. And we'll cover that in just a little bit here. Oh, there it is. I just did that. Let's do some case studies. These are always interesting. If you saw our presentation yesterday or you've reviewed it, the tape presentation, we go on a hike. This guy here bails out of the hike. He turns into our hiking guide. We're there with a group. Heather there in pink, that's my wife. She takes a little slip. She bends her knee, twists her knee, takes a fall, injures herself. We go home. Wait till the swelling goes down. It really doesn't resolve. She continues to have pain and problems. So it's time for us to try the system out and see how they can help us. So kind of let the cat out of the bag here. Eventually, Heather's diagnosed with a medial meniscal tear. This is the process. So she falls. She has an accident or an injury. First thing we do is we go to our general practitioner. He or she is the gatekeeper. You have to see them first. Then they'll go on ahead and make a decision where you go next. So they refer us to an orthopedist. This orthopedist is a gatekeeper as well. And so they're going to make the decision where we go and what we do. So the orthopedic gatekeeper does an exam, orders an MRI. Next step, we go get the MRI. So now we return with the results to that gatekeeper, orthopedist. He reviews the results of the MRI. He diagnoses Heather with a medial meniscal tear. We make the decision that we're going to go now get an orthopedic consultation with a surgeon. So we get a referral to an orthopedist now who is a surgeon. He as well does an exam, reviews the MRI, confirms the diagnosis, medial meniscal tear. We get scheduled for outpatient arthroscopic surgery. The day of the surgery, Heather presents to an absolutely gorgeous outpatient surgery center. If you ever get a chance to send Heather a message or catch her on one of our next presentations, ask her how it feels to be treated like a rock star. This is kind of the way she described it. They were expecting us. They don't see a lot of expats, gringos, North Americans. So it was kind of a novelty for them. They were all excited. The entire surgery center knew about it. This is what she's telling me. They take her into the surgical suite. She kind of described it as it was kind of an open situation. There were many patients in there getting similar procedures, and they were all in kind of different phases of the process. They put her under. She has her procedure. She's happy. They're happy. She gets released. We go. So now what are we going to do? So now we're going to get started with the rehab, and it's important to get that started as soon as possible. So under the EPS, we're going to go investigate the PT or the rehab situation. And so we went for the first visit. It's in a big open setting, so there's 10 or 15 other people in there getting rehab for similar procedures or similar rehabilitation. She did some exercises. There wasn't a lot of supervision. There was only one PT in there. This situation is not an uncommon situation for the U.S. PT as well. We kind of looked at it and we said, hey, listen, we've got the option of having a private physical therapist. Let's explore that. So we had a private PT come to the house. She charged us approximately $15 a session. It was anywhere between an hour and 10, hour and 30 minutes, just depending on the session. She did about 20 sessions. She brought all the equipment with her, TENS, ultrasound, weights. So when we did the analysis, it was, well, we could go take a taxi and drive to this EPS facility. So we got to go and come back. We'll probably spend $6, $8 just in cab fare and double the amount of time and the inconvenience of having to go somewhere else. So the self-pay in-home worked out well. It was really good value. We do our follow-up exam with the orthopedist that did the surgery. He releases Heather, and we've got a good outcome. Total cost for the PT was $300. That was a cash situation. There was a $75 copay for this surgery, so all in $375. Another case study, Joe. Joe, he enters the EPS system for the first time. So what's he going to do? He's going to go see his primary care physician. They do a bunch of tests just to get him, in the system. They do blood work. They diagnose him as a type 2 diabetic. And so what they do here for diabetics, it's kind of a team approach. So you've got the general practitioner manages you, but you also have to go see a psychiatrist, a nutritionist, a nurse or a nurse practitioner, and then you finally make it to the endocrinologist, who is the specialist. And so in between the endocrinologist and the general practitioner, his condition which is diabetes, is going to be managed. So Joe is given some prescriptions. He can purchase his 1 month supply of insulin and testing supplies. I think he was also taking some pills with a prescription from his EPS physician. All those prescriptions and supplies, it's $1 copay. If he didn't want to go through the EPS pharmacy, I don't know why he wouldn't, but for some reason if he didn't, he could buy all those over-the-counter medications. He could buy all those medications over-the-counter for $10, and you could do that without a prescription. He also shared with his GP or the endocrinologist, I don't remember which, that he needed a little help, so they gave him a script for a 1 month supply of Cialis. Cialis is not covered under this EPS system. You'll see here in just a little bit. But for $32 a month, he could have a monthly supply of that. So another example of just kind of mixing and matching the system with cash. Sue, she sees her primary care physician, refers her to an EPS dermatologist who is a specialist. Took her a month to see the dermatologist. Dermatologist prescribes a non-covered prescription. So here we are, another non-covered prescription for her rosacea. That was the diagnosis. That turned out to be $65 cash or credit card for a month's supply of that. Another mix and match situation. Zoe, oh gosh. So she's had neck pain, and she says it's extreme for 2 to 3 days. She goes on WebMD, okay, so now after she reads what's on WebMD, she diagnoses herself with spinal meningitis. So one morning at 3 a.m., she says, oh, enough is enough because I'm on my deathbed. We got to go. So she takes a taxi to her assigned EPS emergency room. When she gets to the emergency room, there are 2 entrances. One entrance is for the EPS holders, and the other entrance is for EPS, but that then have the supplements or the jazzed up version, or maybe they're just private or cash pay. So you've got two separate entrances. So she goes to the EPS entrance. It's 3 in the morning, 4 in the morning, so it doesn't take her long to see someone. She checks in, they do a triage. She's examined and diagnosed by an intern. He gives her the diagnosis of muscle spasm. He allays her fears because he's seen a lot of spinal meningitis. She doesn't present that way. So what he does is he says, I'm sending you back to your home clinic with this prescription. She goes there. She gets an injection that's administered by a nurse practitioner, relieves the pain, totally resolves. This whole event here is $1. Heather, I may skip some of these. Heather and Jeff, they go to their optometrist for their annual checkup. So we did this when we first started in the system. Heather scheduled those appointments up online. We received reminders via text, email, and EPS also has an application. We arrive there. The optometrist speaks English, which is great. And again, we get just treated like rock stars. It's unbelievable. We're still a bit of a novelty in the country, in the city, and in the system. So Heather gets a new prescription for her glasses. She purchases top-of-the-line progressive lenses. She gets them in a fancy fashion frame, and the total cost is $250. She's able to use her U.S. credit card, so whatever the exchange is, we get to leverage that. This is Heather and the gal that did one of the exams, and if you look behind this fancy, whatever this is, she has on her face, just past those, you can see the fancy frames and glasses that she got. I was really impressed. A lot of the equipment that they had there were things that I had never seen before. She also gets a prescription and a 1-month progressive contact lenses. So this is a test. So for $9, they do an exam. She gets a month's supply of progressive contacts. Once she goes back and reports that the contacts work well, she gets a 6-month supply of contacts for $60. And again, that goes on her credit card. I'm going to breeze through these a little bit faster here. Jeff and Heather, we establish ourselves with a dentist. So we go get our annual checkup, which is scheduled online and is $1. We then have them refer us to come back and do a cleaning. We get a cleaning. It's $1. They said, hey, you've got some recession. Let's do some bonding. We go back. They do some resin bonding at the gum line. For each of us, it's $1. I had a crack in my bridge. It's been 5 or 7 years. Every time I go see a dentist here or in the States, they want to replace my bridge. I finally get to a dentist through the EPS system. He spends about an hour. He bonds this bridge up, matches the color, $60. Okay, everybody else wanted to charge me $4,000 in the U.S. for a new bridge or $2,000 in Colombia for a new bridge. This is a biggie here, and I'm winding down. Get your questions ready because I really want to address those. So my mom calls me up. She says, honey, I just got quoted $7,000 for a dental implant and a crown, and this is in the U.S. She lets me know she actually needs 4 implants and 4 crowns. So do the math. That's $24,000. Mom says, do you think I can get it done cheaper there? I said, let's look around. I go and I interview 3 physicians, 3 dentists, get 3 quotes, 3 distinct quotes. And I think that was just based on their location in the city. Bottom line is my mom comes. She has 4 implants installed. They're $1,000 each, $4,000. Mom returns in 3 months and has 4 crowns installed, $1,000 each. It's another $4,000. She spends approximately $1,000 in travel expenses for both these trips. On her second trip, she stays in a really high-end assisted living facility. That's Habitat. That's one of the presenters later on today, so pay attention to them. But I got to tell you, the facility was immaculate. It was kind of like a country club. $2,000 all in. Food, board. I mean, they'll tell you all about it, but she absolutely loved it. So bottom line, in the U.S., she got quoted $24K. In Colombia, all in, that's travel, the installation, everything, $12,000. Net savings of $12,000. She really appreciated that. She got to visit with us. I'm going to skip that. I'm going to check my time. Okay. Enough dental. So in my opinion, the EPS system is constantly improving. In the 3 years we've been here, we've seen all kinds of improvements and changes. Look at this. This is kind of cool. So this is an app that you can order your prescription. It'll give you a ticket so that you can then go to the pharmacy and you're already in line, or you can order your prescription to be delivered online. Your copay for your prescriptions is $1, whether it's 1 or 10, and then the delivery fee is $1 as well. Speaking of prescriptions, cost comparison, name brand pharmaceuticals versus generic. This is an apples to apples comparison. You can see it's in dollars. I believe that every single one of these could be bought over the counter without a prescription. The things that you can't get without prescriptions are things like opioids and psychotropics. This. Tons of natural healthcare remedies in the city. You've got a lot of options. My recommendation is to get referrals from expats, people that have had an experience with a provider. You can get U.S. trained massage therapy, acupuncture, chiropractic, anywhere between, let's say, $25 and $50, just depending on the service and what they're providing. Oh, there's my timer. Health food stores, supplements, herbs, organic. We can get a big basket of organic produce, $5 delivered to our place. Tons of gyms, yoga, dance, stem cell therapy. Colombians are definitely becoming more and more health conscious, but they also want alternatives to the medical system. I encourage you, if you have any questions that aren't answered here during the presentation, contact us. You've got our direct WhatsApp number here. Like and follow our Facebook page, because that's another way to contact us and also keep in touch with us. The name of the page is Travel, Tips, Picks, Tricks, Jeff, and Heather. Check us out, and I'm ready for some questions.
Great. Thanks for that, Jeff. So there's a few up already. I think you already answered the one. The cost of the surgery and the MRI, that whole experience was $375, and the bulk of that was the private physical therapy, which is great.
That is correct. Correct.
And then the next question, everything you're describing, that's just through the EPS system, which is effectively the national healthcare system, and they even have that app now, which is great to make life easier.
That is correct. We don't have a supplement. I know people that have supplements. You've got a vendor that's going to be talking about those, so that's it.
Yeah,
other than the fact that you can mix and match it. So there are a lot of expats that maybe just buy the basic EPS like we do, like we have, and you just kind of mix and match. If it's not convenient to wait for a referral, go pay somebody $50 to see a specialist immediately.
Right. Well, that's the one benefit of Colombia. Just being cash only without insurance isn't terribly expensive for most things.
It's an option, and I know a lot of expats that do that.
And then someone asks a very specific question, so if you don't know the answer, I'll understand. Is the Freestyle Libre sensor system for type 2 diabetes available in Colombia with or without a prescription?
I do not know, but that's a great question.
Yeah, that's a very technical one.
Very, very specific. Oh, hold on. That's the one where they put the patch on your arm, and then your blood glucose readings goes to a monitor or the physician. I looked into that. No, I can't. I couldn't find that. Great question. Okay. and I can't believe that I pulled that one out.
I can say one thing about insulin prices anyway in Colombia versus Panama, because we have someone who works for us that asked us to bring back insulin every time we're in Colombia for her son, and it's a fraction of the cost in Colombia compared to even Panama.
Unbelievable. Quick question for you. Is it the Lantus or the, do you know what it is?
I don't know because I don't usually have anything to do with it. She has the maid pick it up and put it in our refrigerator, and we just take it back to Panama with us when we fly.
It's cheap. I mean, I would load up.
Next question. So did you get a license to practice in Colombia for your chiropractor? I don't think you are practicing, are you?
I dabble. Mostly just take care of friends and family. So in Colombia, chiropractic's not a recognized profession. So really, I'm kind of in limbo. Things like acupuncture, if you were an acupuncturist from the U.S., you'd have to get licensed here. If you were a massage therapist from the U.S., you'd have to get licensed here because those are regulated professions. Good question.
And the question is coming from a veterinarian, so they would just have to go through a licensing procedure there. And really, the best person to ask about that would be an attorney. So Juan Dario can probably
ask the attorney and actually pick the brains of maybe some vets that are local. Good question.
Great. And then one final question before we let you go: is there an age limit for EPS? And I think the health insurance presenter said there wasn't. There is for the local private insurance. The age restriction is to get in before your 60th birthday, but for EPS, that's for everybody, right?
I know expats, I know friends and patients that are in the EPS system, and they're upwards of 75, 78 years old, so they have coverage.
Great. All right, well, thank you for all of that, Jeff. We really appreciate it. Glad you got your microphone working, and also appreciate you doing the recording yesterday.
Thanks so much for having us, and we'll see you at next year's conference. And send us any questions, and like us, and follow us on Facebook. Thank you so much. Have a wonderful day.
All right. Thank you, everyone. We will be back in about 8 minutes with our next presentation. Sorry, cut myself off in the next room. See you there.